Bernie Sanders from Vermont.
This is a bipartisan effort. It's the only independent in the Congress. I don't know if we have any Republicans here, but at least I'll add my voice to the effort for a single-payer system. President Clinton, as others have said, deserves an enormous amount of credit for being the first president that we have ever had to finally stand up and say the truth. The current health care system is disintegrating, it is wasteful, it is killing people, and we need a major overhaul of that system. And the president deserves enormous credit for leading us in that direction. Every person in this room, every person here, agrees that universal comprehensive health care, as the president indicated, is what we must strive for. But it is our belief and my belief that the only way in which we are going to provide high quality, comprehensive, universal health care to every man, woman, and child in this country is through a simple system, the Canadian single-payer system. Now, I come from a small state, the state of Vermont, and we're debating single-payer versus multi-payer. Recently, the Vermont Health Care Authority, sponsored by the state to study the issue, indicated that a single-payer system could save us, in our small state, some $80 million a year alone on administrative costs. It seems to me that the way that we can really save significant amounts of money is to stand up to the pharmaceutical industry, and only a single-payer system can do that, to eliminate the 1,500 private insurance companies that are costing us some $80 or $90 billion a year in administrative waste, to finally tell some physicians that they cannot make all of the money that they like. And if we do that through a single-payer system, through a simple system, which gives a little card to every person, allows them to go to any doctor they want, complete freedom of choice, any hospital that they want. In my view, and I think the view of all of us, we can provide quality care, freedom of choice to every man, woman, and child in this country without spending a penny more than the $900 billion a year we're spending. And as Dr. McDermott indicated, throughout the grassroots of America, there are hundreds and hundreds of organizations who understand that principle and are going to join with us in the fight for a single-payer healthcare system. Thank you.
And now Nancy Pelosi from San Francisco.
Thank you very much, Congressman McDermott, for holding this press conference and for your leadership on the single-payer proposal. I remain a staunch and ardent supporter of the McDermott-Conyers bill. I am very pleased with the President's presentation last night. I'm sure others this morning have told you that he made an excellent diagnosis of the problem, and now we have to get on with how we take care of providing health care to all Americans. My problem with the President's proposal, if there is a problem, is that one of the principles of universal access, one of the principles of the single-payer bill is universal access. The President has accepted some of the principles of the McDermott legislation, be it universal access, no precondition, portability, you know, the list goes on and on. But for access to be universal, it must be affordable. And my concern is that at 150% of poverty, a family would have to start paying for its 20% share of the insurance, may not make it affordable to many of the families whose needs it hopes to address. There is already a concession on part of the federal government that a family needs food stamps if they're at 185% of the poverty level. If we admit that people cannot feed their families at below 185% of poverty, how then can we expect them to pay for access to insurance at 150% of poverty? I think the President has is on the right track. I think the closer he moves toward the single payer, the better. As I've said before, I hope that this plan, and when I say hope, I mean that I will join with my colleagues here in working to see that the plan that the Congress passes contains as many of the provisions of single payer as possible, that it does not foreclose on an eventual single payer, and that it does not throw up obstacles to states easily establishing their own single payer. Once again, I want to commend Mr. McDermott and Mr. Conyers for their leadership on this. Thank you.
Now we'll try and answer some questions if you have some.
Congressman, you worried that in continuing to push your own plan that you may be robbing the president of some momentum that he needs in order for anything to happen?
I think what you're seeing beginning today is going to be about 6 months of very intense debate in which there are going to be all kinds of proposals laid on the table. And I think it's important that the people in this country who support the single-payer system have people represent them aggressively in the Congress. We know and we intend sometime in July, early August, we're going to pass a bill. And I think that it will not be an easy process, but I think that all of us here are committed because the president has set the proper goals. And it now is just a discussion of whether or not his proposal reaches the goals that he set. I don't think we take anything away from his effort.
Congressman, how will you defend against some of the criticisms against the Canadian system, such as rationing, lineups, and the push for user fees by some of the provinces?
Well, part of what we will do to deal with that whole question is hearings. The Ways and Means Committee is going to have hearings from now until Christmas time. And we will get people in to actually look at those issues. I have personally, having lived in Seattle on the Canadian border, looked at this issue. Every time anybody gives me anything in the way of a criticism of the Canadian system, I say, give me the specifics, and I trace it down. People say Canadians come down to the United States, but in fact, only 4% of the Canadian budget is spent in the United States. 2% of it is spent by snowbirds, people who get out of the winter and get sick when they're in Florida and California and Arizona. The other 2% is spent in buying smart in the United States. For instance, the one you always hear about is, well, didn't they have all those heart patients who had to come down from Vancouver to Seattle? The British Columbia government said to themselves, it's cheaper for us to send people 120 miles down the road to the University of Washington, use their unused capacity, pay less than an American patient would pay in the same situation than for us to build it here in Vancouver. They did the same when I was an intern in Buffalo. People came down from Toronto. So all of those criticisms are simply thrown up by those who oppose the system, and there is no substance to them. We're actually going to have a seminar next week with some Canadians down here in the capital so people can actually come and ask questions of people involved in the Canadian system as to whether or not there's any truth to the kind of myths that are thrown up.
Can I just, our state also borders on Canada. And I think what we should recognize is that the insurance companies and the money interests are spending an enormous amount of money to malign the Canadian system. 2 points that should be made. In terms of per capita expenditure, we're not dealing apples and apples. We are spending as a nation 30% more per capita than the Canadians. So if there are some problems in the Canadian system, such as lack of technology in certain areas, we have the money to spend to alleviate those problems. Second of all, the proof is in the political pudding. The Canadian government today is not a radical government. It's not a progressive government. It is a conservative government. And I know many Republicans were upset. You remember several months ago when a representative from the Canadian embassy was here, and this guy strongly defended the Canadian system, because not to defend it is very bad politics in Canada. We've got three major political parties. They all support it because that's what the people of Canada want.
Congressman, how would single-payer affect undocumented aliens?
The healthcare system that we have set up in H.R. 1200 covers all Americans who are here legally. They would all get a card. Resident workers in the fields of Seattle and Washington State, the migrant workers would be covered along with everybody else who's a resident legally here in this country. That's true in Germany. That's true in every other country.
Illegally.
I'm sorry?
What about the ones that are here
illegally? That's a question of immigration. It's not a question of the medical system. Until we make a rule in this country that we are not going to cover people who somehow come into a hospital without some kind of proof of citizenship, they will be covered in the system as they are now. And my belief is that you can't say you're not going to cover people. And if you're going to make a rule, otherwise you're going to have everybody in this country with some kind of document that they have to go every time they go anywhere to prove that they're a citizen. In this country, you're going to go into hospitals, but everybody else will be enrolled in the program, the national program.